Exactly.
Are there things about Botox that are negative that are tied to infertility and or hormonal?
Yeah. Well, for me, so I've done a lot of research. And it's always like, it's so funny because I'm literally married to a plastic surgeon who's like, shut the fuck up. Let them come and get their Botox.
Yeah. Come on in.
Well, thank
the tables
you.
have turned. Hop on in.
Oh my God, hop on in.
Yeah.
All right, this is, do y'all have a little ladder for me?
Wait, do you need a little?
I need a lift, yes, please. And I'm here.
I've always wanted to do that. I don't know why, but scratch that off my bucket list.
Oh my gosh. This is so
Welcome.
fun. Thank
Bring this
you.
guy in. He's a little
Thank
dusty.
you.
He's been places. I feel like far away. I feel a little far away from you, but I feel like we can still connect. Have you?
Yes, we're here. We're together. It's going to be
We're
okay.
here. Thank you for the little fuzzy socks.
You're so welcome.
Welcome to the Stirrup.
Thanks for having me. I'm so
Very
excited to be here.
I'm so excited to have you here. Just for the listeners, hey guys, I'm Jade Catapretta, and this is The Stirrup, a podcast brought to you by O Positiv, where we stir up all things women, all things health, all things vagina. Let's get right to it. Honestly, the whole reason why I wanted to do this podcast was to meet you, which is so exciting.
Aww.
We have in the house triple certified OBGYN, mother of 4, kick-ass lady, Dr. Roxanne Pero. Everybody?
Yeah. Woo!
I think it's fair to say you're one of the leading experts in perimenopause right now. Not a lot of people are talking about it in the way that you are. So tell us a little bit about like your journey and how you got into sort of functional medicine and perimenopause information for women.
Yeah. Well, thank you, Jade, and thank you for that introduction.
Oh, you're welcome.
I would say that most people that get into integrative functional medicine have their own health journeys that led them there. And so for me, it was very much infertility. Unfortunately, when my husband and I started trying for pregnancy, it didn't happen. And we went through 4 long years of just all the things, poking, prodding, IVF, artificial insemination, all the things.
Wow.
And I kind of reflected back on that after and that whole experience. And I mean, yes, now I have more kids than I know what to do with, but I really thought about it and was like, you know what? No one ever once talked to me about, hey, well, what can you do while we're doing all this testing and ultrasounds? And, can you do something about your nutrition or all these hardcore exercises that you're doing? Is that impacting anything? Your stress level? And so I just felt really disconnected from my body and that whole experience. And so especially going into my 40s, I was just like, no, that's not going to be how I tackle perimenopause. And so I ended up just translating that kind of care, my self-care, to my patients and my practice. And so kind of got out of the conventional medicine side of things, but I still love doing all the normal conventional medicine stuff. I still like having a haven for women to come and do their pap smears and do their annual exams, but also just like a little bit of personalization goes a long way for women's health.
I think that's so important. I think so many women don't go to the gynecologist now because they're scared that they're not going to be heard.
Yes.
Like for me, it took me a long time to figure out perimenopause and what was going on. So thank you for, giving that kind of care. And like, can you explain a little bit for people like who have never heard, like what is perimenopause?
Yes. So technical definition of perimenopause is onset of symptoms 7 to 10 years prior to full-blown menopause. So full-blown menopause is really defined as, and it's sad that the only definition for it is related to periods, but cessation of periods for 12 months. So once you look back and realize that you haven't had a period for 12 months, then you could say, oh, I was in menopause then, but now I'm postmenopausal. So menopause gets a lot of discussion, but it's really not a big part of what should be talked about the most, which is honestly perimenopause. So just like you said, with your experience, I mean, what a roller coaster, right?
Yeah, it's kind of funny because like everybody knows menopause. It's like the hotter sister, but I
Yeah.
feel like perimenopause is really like what we're all going through.
Exactly.
And nobody knows. Like, I think we all just look back like, oh, our moms are just kind of depressed in their late 30s and early 40s.
Right.
Like, they didn't want to hang out with us as much. But like, I think it's important for women to go, hey, perimenopause isn't something that happens to older women. It's like what's happening to you in your late 30s, early 40s, up until the very last day of your period, which menopause.
Exactly.
What are some symptoms that women should be looking out for? I know the list is like ridiculous.
It's insane.
But what are some things that you've seen over and over sort of in your patients that people could look out for, you know, before getting their blood tested?
Yeah. So I think that the most common symptom is probably the irregular periods. So just out of the blue, all of a sudden you have a period that, you know, comes 2 weeks early or is 6 weeks late. And then hot flashes, night sweats, of course. But some symptoms that people don't really think about attributing to perimenopause, like palpitations,
Heart palpitations.
headaches, yes, anxiety, depression. I mean, the mood changes for perimenopause for me personally was like one of the biggest,
Same.
mindfucks.
Just
like,
so
honestly.
upset. Just so upset. Like I would get the
Yes.
wrong milk at Starbucks and I'd be like, I'd start crying.
Yes.
Like just the most, the littlest things. Like, wait, can we do a list and then we can do a graphic? Okay, so tell me some stuff. Like the biggest one. So night sweats.
Night sweats, hot flashes, irregular periods, heart palpitations, joint pain, headaches, hair thinning, skin changes, weight gain,
It's the best being a woman, isn't
anal
it?
itching.
Anal itching. Oh my God. We're just sitting on our chairs going like this. I love how men just scratch their balls, but like we're not allowed, even though we don't even have hormones or a butt itch. It's so unfair.
Yeah, right?
Now, do you think, I've talked a lot about this, but like you're very big on removing toxins and endocrine disruptors.
Yes.
We've talked a lot about this on the podcast, but like explain a little bit what endocrine disruptors are in our
Yes.
environment.
So endocrine disruptors can be both synthetic, man-made, but also natural. There are natural endocrine disruptors out there. And so what they do is that they either mimic hormones like estrogens, or they block or activate the receptors for hormones. So therefore, and anything endocrine has to do with your hormones. So they disrupt your hormones. Yeah.
So what are like some big ones that all of us don't want to hear about, but that are happening? I know skincare products, we're getting a little more privy to like how horrible they are. And I think they're linking now early menopause to women who start using products very early on.
Absolutely.
So what are some big things that you've cut out of your life, your diet, that women should maybe look into?
Yeah. Well, phthalates are a big one that have been studied to show that women that are exposed to phthalates are at an increased risk of going into early menopause by 3 to 3.5 years earlier. And you think about it, you know, you're just like, oh, well, that's fine. I don't really like my periods. But then when you actually experience perimenopause, you're like, fuck no, delay this as long as I can.
need hormone. I feel like I'm like a drug addict. Like, anybody got hormones? Like I'm a crackhead for hormones now all of a sudden. But like, what are phthalates and what are they?
So phthalates are they help to bind. So when you think about like your lipstick that has a rich color or color stay, phthalates are some of the things in there that help it to do that. But phthalates are also in food. They're in our air. They're ubiquitous. They're in plastics. Obviously, BPA is one of the ones that, you know, you'll have your plastic bottles that say BPA free, but then they probably have phthalates in them. And it's one of the things that is just, it can be really overwhelming to think about all the toxins that could impact your hormones. And so we talked about, you know, apps that they have. You know, it's so easy to scan things these days and not get overwhelmed about it and just kind of do a slow removal of toxic skincare products and home cleaning things. But isn't it wild to think that something that you put on your skin can mess up your hormones?
No, I never even put it together, because first it was like, okay, food, right? Like for me, it was like nutrition. Like, I got to eat more spinach. Like that was I'm so sick of fucking spinach. That's all I eat. I'm Popeye. But like, then I started to go like, oh, okay, it's my makeup. And then it's like my lotion that I'm putting on my body, and it's my hair products, and it's what I'm cleaning my house with and what I'm washing my clothes with. So like, I think it can be very overwhelming. So I've started slow. I use Yuka. What are some other apps that you recommend for people to use?
The EWG, the Environmental Working Group, has the Think
Okay.
Dirty app. So those are my two go-tos.
Wait, it's Thick Dirty?
Think
Oh, I was like, Thick Dirty. Okay. It's a good app name.
Think Dirty, yeah.
Think Dirty app. So like, just you guys go home, like scan some stuff. Like I obviously was scanning all the bad shit just to be like, okay, Cheetos are bad. Like I
Right,
get it.
right.
But it's surprising what products kind of have endocrine disruptors and hormonal disruptors. And
Right.
so just like have knowledge. Like,
Right.
and it's hard to hear. Like all your favorite perfumes, fragrance. Can we talk a little bit about fragrance?
Yes,
Yeah.
yes. Fragrance has, and there's so many, fragrance is allowed to be on bottles because they have proprietary blends. And so they don't have to disclose everything that they have in them. But unfortunately, most products that have the word fragrance have toxins, and those may be phthalates, but it may be other toxins as well, just from the manufacturing process. And so you really want to think about RMS has a great fragrance that's toxin free and smells amazing. Or it's kind of nice when you do detoxify your body, like you don't actually smell.
Well, it's funny because when perimenopause first kind of hit me, I stank. Like I stopped using, conventional deodorants, and I was like, oh my God, I smell
all at once.
Yeah, and then I did everything at once. I just smelled. My hair looked like shit. I had no makeup on. But I think now I've adjusted to not having.
Yeah.
I finally found a deodorant that's everything free.
Yes.
It's just air. It's just air. And then for fragrances, you guys are thinking okay, so I can't use perfume, anything that's maybe oil based, right? Like more of an oil base.
Exactly.
Yeah, fragrance is a dirty word. So if you're looking through your ingredients, right, fragrance is something to always look out for.
Absolutely.
If it has fragrance, maybe investigate.
Yes.
A little deeper.
Yes. And I think that, I think documentaries are great for kind of moving the needle to get you to, there's a great documentary. It's super old, but it's called
Yeah.
Toxic Beauty. Have you heard of it?
Oh God, it's gonna ruin every documentary ruins me a little bit. It's I
just-
don't want to know, but I
it
need
makes
to.
you mad, right?
It does.
It's you don't want to be a mindful consumer. You just want to just go and buy something and feel
Yeah.
like the people that are making these it's safe for you, but it's really not, unfortunately.
I know, and there's so many laws in Europe, but in America, they're
Yes.
fuck it, let's
Yes.
just do it good old America.
Yes.
And now I'm just at the grocery store, literally scanning everything, just mad. I get green, I'm buying it. I don't even like couscous. I'm
Right,
we're doing
right.
it. For you, in your whole fertility journey, what was some foods, some nutrition that you feel sort of helped you along the way?
Yeah.
Just for women who are
Yeah.
kind of in that journey.
Again, learning, because then I didn't change anything. I was hardcore paleo. I was eating give me all the meats. I was carnivore.
Yeah.
And Harvard Health did a study that showed that plant predominant, healthy fats, lean organic meats are really the nuts and bolts for healthy nutrition for fertility.
Right.
So I think that's low hanging fruit, just to let patients know, hey, this is something that can make a big impact. I think there was a study that showed that 32% of the time for people that ate meat heavy meals, they would have anovulation. So from month to month, 32% of the time they wouldn't ovulate. And that's huge, you know, and you'll go to the doctor and most doctors will say, well, wait a year and then come back if you still haven't gotten pregnant. In all that time, they could have done something differently on their own,
I think we all kind of want give me a pill or give me something fat, give me an injection.
Yeah.
That's another thing that, I've been kind of dealing with sort of, I don't know, I'm kind of mourning this, my younger self, right? And my skin and how quickly I could lose weight and all this stuff. But so finding alternatives to just the quick fixes have been difficult for me.
Yeah.
One thing that you really talk about is for skin, let's get a little into skin, just red light therapy.
Yes.
That's just being in front of a red light.
Yes.
During red light therapy, talk a little bit about that gua sha,
yeah,
all
for
your
sure.
favorites.
For sure. It's interesting because I often tell patients look, you should feel like you're back to your 20s because you have acne and you want to take off all your clothes.
I'm not there. I would like whatever horny hormone you're giving people. Because I'm on hormone therapy. I told you I take
Yeah.
progesterone and then
Yeah.
estrogen little patch. I'm like, but yeah, I would love a little like horn dog. Is that
We'll talk more about
testosterone?
that. Yeah, it's testosterone. So
Yeah.
skin.
Okay,
Let's
skin.
stay on task.
Yeah.
So yeah, red light therapy is something that is obviously non-toxic. It's safe. It has so many just longevity, optimal health properties. But yeah, it can help to stimulate synthesis of collagen, which we know is plumping
Collagen
and
is
hydrating
everything.
and wrinkle-free. Vitamin C is a big one, so vitamin C serum is most of the time non-toxic. You can
Right.
put that on your skin. And then even ingesting vitamin C. So I usually do 2,000 to 5,000 milligrams of vitamin C.
Damn, girl.
Yeah, I know.
That's
Yeah,
a lot.
mhm,
Okay,
yeah.
I need to do 2
I'm regular.
chewies. I'm just doing 1 chewy at the time. And red light therapy is also good for your circadian rhythm, right? Which is something that's really
Absolutely.
good for better sleep when you're
Yes.
going through.
Absolutely. Absolutely.
Cool. So I just sit in front of mine like this close.
Yeah, yeah. Which
Every
one,
morning.
Which one do you have?
I have a little square.
Nice.
So I just sit in front of it. I turn it on right in the morning just to get my rhythm going because I have a
Yes.
hard time getting out of bed.
Right?
'Cause I was-
That was a big thing for perimenopause. Yeah.
Yeah, I just have the heart, like sleeping is just very difficult for me. Before hormones, I would just wake up with my heart like beating out of my chest for no
Yes.
reason.
Yes.
Which was so fun. Okay, so red light therapy and then facial massages, lymphatic
Yes.
drainage.
Yes, huge. So, you talk a lot about it, working your neck. Like so many things are connected, it's not just here.
was like,
like the
Yeah.
fascia, which is the connective tissue underneath your skin, which is
Yeah.
really what, if you go and have a facelift, that's what they're lifting
tuck
up.
it,
It's not the
yeah.
actual skin. So doing those types of exercises that is helping to loosen that can be really helpful for healthy skin aging.
Yeah, like I have a little bit of an old neck just right here, from
Right,
right
I'm
here to
getting
right here.
this.
I'm 80. Like, how do is there like do you tape at night? Like, is taping something you do?
Yeah, I want to do it. I literally bought them. I have
Yeah.
them, but I pulled them out, and of course I don't read the directions,
Yeah.
so I just opened it out, and it like got all
Like
sticky and
tangled up. You're
stuck
like, I
and
can't.
falling out.
I tape. I do like here and then the 11s. And then I
Nice.
just started doing my neck, but I'm kind of like, I can't really
You
breathe,
look
but I'm
so
like, it's worth it.
good.
Thanks. I feel like you look younger than me and you have 4 children. So I need to get on whatever.
Oh,
Or-
those kids keep me.
They keep you young. And then gua sha. Do you recommend gua sha? And like,
Yes,
do you
yes.
recommend this thing? Like the hairband on your ears? Have you seen
Oh,
this?
I haven't seen that.
They say that like if you put it in your ears for like 30 minutes, there's like a drainage that you do for hair. I haven't
Interesting.
tried. It's a TikTok.
Interesting.
Doctor.
Okay.
Yeah.
I'd be up for that.
Okay.
Acupuncture too. I have an acupuncturist
Okay.
at my clinic, and I need to get with her because they have acupuncture for anti-aging as well.
But isn't that like a lot that you have to get a bunch of needles on your face for
I
the
don't
aging
know.
stuff?
I don't know.
Hey, who's that horror film guy with all the needles?
Yeah.
They're so young. They have no idea what I'm talking about. Do you guys know what I'm talking about? Hellraiser.
Who is it?
Hellraiser.
Yes.
That's me. That's me trying to stay young. Hell raising. So acupuncture, gua sha, lymphatic drainage, all the stuff we don't want to hear, right? 'Cause we
Right.
just want to go and get injected. Like,
Exactly.
are there things about Botox that are negative that are tied to infertility and or hormonal?
Yeah. Well, for me, so I've done a lot of research. And it's always like, it's so funny because
Yeah.
I'm literally married to a plastic surgeon who's like, shut the fuck up. Let
Can I
them
talk
come
to you
and
for a
get their Botox.
Yeah. That's so funny. You guys are literally like yin yang.
It's so funny.
Yeah.
It's so funny. But I mean, so the fact is, like, you can't expect to put anything on your face or injection wise and think that it's going to stay exactly there. Like,
Right.
everything still gets metabolized. So the byproducts of the Botox are going to go into your bloodstream. They're going to go into your liver and they have to be metabolized. So I often say, like, yeah, if you're putting a known toxin into your body, you better make sure that you have a healthy liver. So if you're detoxifying, if you're coming to me and you have mold toxicity or BPA toxicity, no, I'm going to recommend that you not do Botox.
Is that something that you can read in your blood test?
So most of the time I do a urine test for those types of toxins. So
Okay, cool. So I'll leave you with a cup. You're like, what is this? I don't. So if let's say you're in your late 30s and you're feeling some mood shifts, what do you recommend? Is it first going through your symptoms, or is it first like getting a blood test? Like, and is there a day that you should get your blood tested, like a day in your cycle?
Yeah. So when perimenopause is like a moving target. And it's so hard to diagnose because I often tell people, look, let's say perimenopause as a diagnosis of exclusion. Let's make sure that there's nothing seriously wrong, right? I'm not going to have a lady come in who's 39 is having heart palpitations. I'm not going to say, yeah, you're in perimenopause. No, I'm going to do a proper workup for heart palpitations.
Right.
That's a big deal, right?
Yeah.
And so blood work, I love doing blood work. But hormones in perimenopause can fluctuate wildly. And so when you're looking at things like estrogen, estrogen is doing a roller coaster in perimenopause. So if I ask someone to, I love doing luteal phase, progesterone, and estrogen levels, so that's day 21.
Okay.
But if I ask someone to do that when they're in perimenopause, I may see lower numbers than I actually expect, or I may see really high numbers. So it's hard to interpret that at
When
that
to
point.
do it. Okay.
Yes. There is a test called an AMH, which is an anti-Mullerian hormone test.
Oh my God.
Yeah, so fancy. Right now they use it in fertility, but it's starting to gain some traction as kind of a gauge on when to potentially anticipate the onset of menopause. So it basically tells you, anti-Mullerian hormone is a hormone that is secreted by all of the little eggs that you have left. So obviously if you have a high number, you would expect that you still have more eggs to ovulate and to be released each month. And if you have a low number, then you would expect to have less. So it's interesting. I don't always hang my hat on the low numbers, but for the higher numbers, I usually tell patients, okay, this looks really good. I'd say let's go looking for some other things, but let's continue to monitor your symptoms of perimenopause and not ignore that. So
Right. I was told to test on the 4th day
that's a good one too.
of my cycle. Yeah. So like it was hard for me because I'm on the road all the time. So I would always miss. I would always be on the road. I'm like, so it took me forever to get to it. But like, honestly, you guys, if you're at home and you feel any kind of shift, like just go do it. Like just go talk to your OBGYN, reach out to any of your friends. Also, let's not make it an embarrassing thing. Let's make it like this exciting new part of your life. Cause I think there's a lot of like tied in with it.
Oh yeah.
It's so cool that you're an OBGYN. I love vaginas, so that would be like so fun for me. Do you have like, what is your craziest gynecological story that you can share with us without getting sued?
Right.
Yeah.
We're about to stir it up.
Let's go.
So surprisingly, I have a lot of out of office experiences. So I won't get sued because this is not a patient, but
just at a grocery store.
It was at a church.
Okay.
So I'm at my girlfriend's wedding and I'm with my other friends. And at the end of the ceremony, one of her family members turns around and says, hey, I know you guys are, doctors with my cousin and I have something really embarrassing, but I was wondering if you could help me out. And so it was myself and my other girlfriend and then our husbands. And so we pulled her aside away from our husbands and we said, what's going on? And she said, I think I have a tampon stuck in my vagina and I don't know what to do about it. And so immediately we said, well, I think you should go to urgent care and get it checked out. She was like, I really don't want to go to urgent care. So she was like, I don't know what else to do. I really don't want to go to urgent care. So my friend, who is like the nicest person in the world, says, well, where are you staying? We can just come and remove it for you. Before I could say anything, it was a done deal. I was like, mayday, no. And it was done. So she was like, okay, well, I'm staying at the hotel where the reception is. So why don't you guys just come up to the hotel before the reception starts? So we had like 3 hours in between. And I was like, I'm going to, say a different name. I was like, Mary, what are we going to do? Like, I don't have gloves. Like, I don't have anything. And she was like, I'll figure it out. Don't worry about it. You won't need to do anything. Just come with me. I feel really bad for this girl. I want to help her out. So I'm just like perseverating about it for the 3 hours before. So we get to the hotel. Our husbands know what we're about to do. And they're like,
I guess we'll go have a beer while you go fish out a tampon.
Bar. They go straight to the bar. We go up to the hotel room. And while we're in the elevator, I'm like, well, what did you find? Did you find some gloves? And she was like, so it's a black friend of mine. She was like, I only had like this perm dye glove that I didn't use. So it's this black glove, just a solitary black glove. So we go up, we knock on the door, and literally she's got mood lighting. Like it was so weird. It was so weird. Like the lights were dimmed. She had the covers pulled over, and she lays on the bed, spreads her legs, and my friend puts the gloves on, and then she, puts her hand, is feeling around, and then she removes her hand and says, "There's nothing there. I didn't find anything." And the girl's like, "No, there's definitely a tampon in there. There's definitely a tampon in there." So at this point, my friend Mary, like, we go into the bathroom, and I'm like, what are we gonna do? What does she want from us? And Mary's like, "Well, you're gonna have to your hand is smaller. You should just put it in there and check." I was like, "Well, we only have one glove. What do you want me to do?" So she pulls the glove off. I shimmy my hand in it. We walk back out into the hotel room. Put my hand up her vagina, and there's nothing in there. There's nothing in there.
You reach around. There's only so much room.
There's only so much. There's no hidden pocket.
Yeah.
So we say, we're like, okay, I guess it must have fell out, but
it was a phantom tampon.
Oh, it was either a phantom tampon or
She just wanted. That's her kink.
Yeah. Our husbands we go down and we tell our husbands, and they're like, "Okay, guys, clearly
you got punked."
Yeah, we got punked, like ultimate punked.
See, this is what bothers me. It's like women are so out of touch with their own body. Like, can you encourage women to like go look at their vaginas and touch their vaginas and like put their hands up there?
Put your hand up your vagina.
I know what's in my vagina at all times. Like I've put in a couple tampons by accident before, but then I realize it right away.
Exactly.
Wow.
Body awareness is huge.
I think there's so much shame that we have with our vaginas. It's like, I don't want to look. I don't want to look. Like, just look. It's
Absolutely.
your own vagina. So I think I've talked a little bit about this, but also just removing the whole like perimenopause is an old thing.
Yes.
Like, what do you talk? Like you said, it can start in your late 30s, right?
Yes.
And you said 7 to 10 years. I had read like 4 to 10, 12 years. So that's such a large window of, the hardest thing for perimenopause for me, besides the mood and the depression and stuff like that, has been the libido, the change in libido.
Absolutely.
Like I'm pervert, I'm Brazilian. Like I thought about sex all the time, and now I'm like, like
not okay.
Yeah, I don't know. It just feels like I just don't have that same drive.
Yeah.
And so what are things that that can help your libido while you're going through perimenopause?
Yeah, absolutely. So, obviously libido is multifactorial, but when you have a patient that's coming in and clearly they are having all the symptoms of perimenopause and low libido is one of them, I really do love checking testosterone levels at that point. So testosterone and DHEA are really important for libido. DHEA is a really long word when you sound it out, so I'm not going to say it. But DHEA is produced by our ovaries and our adrenals, and it really helps with it's part of our libido as well. So those two are some tests that I check for. And so if testosterone is low, if DHEA is low, those are things that I'm talking to patients about supplementing with. Some women are weird about testosterone,
because they're aware they're going to get like a beard.
Yeah. So I do there's obviously side effects to everything.
Right.
Sometimes, and I'll tell them, I was like, look, when you read my note or if you open the package insert, it may say it might cause clitoromegaly.
What is that? Is that expanded?
Yes, let's do a guessing game. Yeah.
Is that when your clit gets huge? Let's go. Where do I get this? I already have a pretty flat, like a fat clit. Like it could be fatter. That's so crazy. So women are scared of that? Women are like, I need my my clit to be dainty?
They want it nice and tucked away. You
Why?
know?
Yeah,
Come
there's
out
more
to play.
nerves. But does it make it more sensitive? Does it make
Hugely more sensitive.
Yeah.
Yes, that's why it's tucked away. Yeah.
Wow, that's so interesting.
Yeah.
Okay, so what are some other symptoms that you could get from taking this?
Okay, so obviously that is extremely rare. And so
okay. I was really hoping for
every woman needs to be monitored. So I have patients come back 6 to 8 weeks and we recheck labs. And so for me, I like testosterone levels 35 to 45. You're really going to get into the, obviously clitoromegaly, hair thinning, oily skin.
hair thinning.
Yeah, abnormal hair growth. You're going to get into those types of scary things at levels like in the hundreds, 200s. So no one should be in those ranges.
Right.
So make sure that you're not just going to some dick in the box to get your
If you're
testing
bald and you
done.
have a beard and your clit's huge, there's something wrong. Go to the
Check
doctor.
their license.
Don't go to the back of the grocery store gynecologist. Okay.
But otherwise, testosterone is it's not FDA approved for women, but all of the gurus that do menopause and sexual health use testosterone off label in women. It's amazing.
What is it? How is it? Is it synthetic? Like, is it a pill? Is it a patch?
It's a gel. It's a gel. Yeah.
Interesting. And then why do we have such a negative connotation with hormones? Is it because of all the research they did in the 90s?
Yeah.
And the headlines that were just completely false?
Yeah. I think for sure that. And we're doing a lot of re-educating and, and that's really, really hard work because even for things like vaginal estrogen, which is safe for anyone that's in perimenopause or menopause, you talk about libido. I haven't experienced vaginal dryness related to perimenopause
I'm a WAP
yet.
for life. Yeah.
But I had that whenever I had a yeast infection. Oh my God.
It's hard.
That I never want to experience that. So vaginal estrogen is amazing, but you will get a package of vaginal estrogen. I will say black box warning, this may cause dementia, cancer, all these things that just aren't true anymore. But the FDA has not removed the black box label from it. It's insane.
Why is there so much black tape with why is there or red tape with FDA and are they just crooked? Are they just crooks at this point?
1,000%.
They allow the fragrance word.
Yeah.
And yet anything that helps women is can give you cancer.
It's
but
insane.
also if you don't take hormones, you're more likely to get osteoporosis, heart disease, bone fractures.
Absolutely. So it's that. It's undoing the miseducation, knowing that there's been 25 plus studies since the Women's Health Initiative that, that said hormone replacement therapy does not cause cancer, does not cause breast cancer. And when you do it right, the major side effects like blood clots or liver damage, those are non-existent. So trying to do topical formulations is always the way to go for estrogens. Progesterone is great. I mean, one of the things that's kind of controversial, I think, with functional versus conventional is that if you don't have a uterus, conventional medicine says you don't need progesterone. Functional medicine, we love progesterone. We know that they have receptors everywhere in our body besides just our uterus. Yes. I'm a different person on progesterone.
Me too. If I forget to, I can't sleep.
Yes.
I literally can't sleep without it.
Yes.
And it's the best, because I've just got on progesterone first.
Yeah.
And then my period never stopped. So then I had to get on estrogen, but I was happy just taking progesterone all the time.
It's amazing. It's very calming.
Women do it.
Yeah, do it.
And so get your blood tested, look at your symptoms, and then from there you can decide what hormones you're taking.
Exactly.
Now let's talk a little supplements because I'm a supplement girl. I'm taking everything. Are there vitamins that, I know you become deficient in folic acid, B12, all that stuff. Are there supplements that you should be taking just in your late 30s that you advise people to take on a daily?
Yeah. I would say my staples are a good multivitamin is always, just basic. We all know the food that we have, that we eat, regardless of how healthy we eat, is devoid of a lot of nutrients.
Oh yeah, food's garbage.
Right?
It's paper.
So B vitamins are a huge one. Zinc is really good for vaginal health too. There's been studies that have shown zinc, vitamin E can be both very helpful for libido. Vitamin D is hands down, every single woman needs to be on vitamin
Yeah,
D.
can we talk about vitamin D? That blew my mind, one of your Instagram posts when you're like, it's a hormone.
Yes. Yes.
So talk a little bit about that.
It's literally a hormone. It acts as a hormone. It's made by our skin and then it travels to places where it needs to work. That's the definition of a hormone, that's made in an organ and then it travels. Again, a lot of misinformation about vitamin D, that if you go out in the sun, you're probably getting enough vitamin D. Absolutely not. And vitamin D is critical for breast health. Studies have shown that optimal vitamin D levels can help reduce your risk of breast cancer. Fertility, vitamin D is an untapped, easy, low-hanging fruit for fertility. So any woman that's trying to conceive, really want to make sure you have optimal vitamin D levels, supplement with vitamin D. Omegas are extremely
fish oil.
important. Yes, fish oil. So, and again, Debbie Downer, you could be like, oh, well, all the fish are contaminated with mercury.
I know.
and stuff.
I've seen all the documentaries, unfortunately,
Oh
during
my gosh.
COVID. That's all I did.
Just take fish oil. So
Yeah.
krill oil is, I think, touted as like the go-to for omega-3s, but having higher omega-3 to omega-6 ratios, nuts, seeds, avocados, healthy fats, those are all really good for omegas.
And I saw like you talked a lot about magnesium as well. Like at nighttime, I have to take magnesium.
Yes.
But what are some like natural forms of magnesium in food? You said spinach was one of the things.
Green leafy vegetables
Yeah.
are huge for magnesium. So yeah.
What are some other things? I saw your thing, but I couldn't like
Ooh.
pause it.
You know, I really, I
Was it
can't
like
even,
flaxseed?
Oh yes,
Yeah.
flax.
Yeah.
Yes, flax is a great one for magnesium. Honestly, I can't remember any of the other ones.
How
My
do you
brain is
feel
mush.
about 5-HTP?
I love 5-HTP. Yeah, I think it works really well for sleep, for mood disorders. So yeah,
Is
that's a great one.
there too much 5-HTP? Because I used to take 5-HTP after I did Molly, like just to even out. Just to even out my head. This was a long time ago.
This was
Like,
a long
I can't
time
even smell alcohol at this point. But now my doctor was saying that I could take it at night just to like
Yeah.
my levels of like happiness a little bit. But is there
Yeah.
like too much? Like, can you overdose on it and then not create your own endorphins?
I don't think so.
Okay.
I wouldn't be worried about that.
I get nervous.
Yeah.
Like sustainability is my thing. I'm like, how long can I do this
yeah.
for? Like,
yeah.
and then ashwagandha, is that something else that you recommend?
Huge. I mean, adaptogens are huge, especially for perimenopause. So, you know, one of our great products with O Positiv is Minnow.
Yeah.
You know, ashwagandha really helps to balance mood, energy. And so you take it in the morning. If you need energy, you take it in the evening. If you need to wind down, and adaptogens, rhodiola, holy basil, those are all great adaptogens.
Holy basil. I never knew about that.
Yeah.
Why is
Yeah.
it holy?
Good question. I
Who
have no idea.
knows? Yeah, and like guys, if you're like you don't want to take vitamins, like eat a gummy. Like there's so much
Exactly.
available product out there
Exactly.
for you to take.
Yeah. And I think too, the stigma is always like, oh, well, I don't want to have to rely on something. Okay. You don't have to rely on something. Well, let's analyze all the things that you're putting on your body before you walk out the door that you're relying on.
Yeah.
You brush your teeth every day, you know, you comb your hair. Yeah, we don't want to have to rely on something. But when it comes to like actually taking care of the inside of us that really matters, it's okay to be on supplements or to take hormone replacement therapy.
Yeah, I
you know?
notice a difference because it's always like people would be like, take this vitamin, take this vitamin. I'm like, okay, cool. This vitamin's gonna like make me feel better. And now if I miss my vitamins in the morning, like
right.
it's fucking over.
Right.
Like I feel such a difference in my mood and my energy.
Absolutely.
So that's cool. There's so many ways to, I mean, it's overwhelming, you guys. It's a lot of stuff, but
Yeah.
it's so doable. Like just go little by little, right? Like every day a
Exactly.
little bit. Use all the resources that you have and just don't ignore it, right? Like,
Exactly. Do not ignore it. Yeah.
and now what's some advice that you have for women who are like later in life, maybe like, late 30s, early 40s, and they do want to get pregnant? Like what's the first step, right? If they've never done anything and they're trying to like change their lifestyle or like investigate non-IVF.
Yeah.
What do you recommend is a first step?
Yeah. Well, I think that's a loaded question.
Sorry, I know it's a lot in one.
Right? Because I don't know exactly what sometimes is a patient's ultimate goal. You know, if your ultimate goal is to have a biological child that is from your DNA and your husband's DNA, naturally, then that's much different from someone who, could entertain the idea of IVF. I always really still like patients to go and talk to a fertility doctor. Yes, you may get depressed after going to visit with them.
Oh yeah, we got depressed talking to one.
Right? Yeah. But at least it's information, you know? And I think, I work with women that are in their mid 40s, 46, even 47, that are trying to become pregnant for the first time. And so I think you still have to have realistic expectations that, hey, there are many things we can do to improve your egg quality, but I can't give you eggs back, right? Unfortunately, every month we're losing hundreds of eggs, but I can improve your egg quality so that as you ovulate each month, you're recruiting the best egg that the sperm really wants to meet. So,
isn't it so crazy? It's like all just like an 8th grade dance.
Yes.
Even inside our bodies.
It really is.
Yeah.
It really is. So we do a lot with supplements. So antioxidants, alpha lipoic acid, resveratrol, high dose omegas. We do red light therapy protocols.
Wow.
We do hyperbaric oxygen therapy protocols.
What is that?
Oh, where you lay in this like really funky glass chamber. Slide into it.
Yeah.
And then you just lay there like a corpse.
And
it brings in super oxygenated air so that it's filling every space in your body that needs oxygen in like a really powerful way. So one cause of ovarian or egg aging, so women that may have really low AMHs and they're not 51, but their AMH levels look like they're 51. It helps to reverse a little bit of that because that's a lot of oxidative stress, which is your environment, pollution, toxins that you're exposed to that are damaging the DNA in your cells. And so,
Jesus.
Yeah. A lot of good oxygen goes a long way. So we have protocols for that.
Can you do that just for anti-aging too, right?
100%. Most of the people that come into our clinic for
if
that.
If I go to Dallas,
anti-aging.
I want to get in your chamber.
Please come.
Yeah.
We will pamper you.
I love that. And then let's talk a little bit about they probably don't want this, but just like drug and alcohol, right? Like drinking alcohol, like you don't necessarily have to cut it fully out. Like what is a healthy amount? I don't know if you can say this out loud with as a doctor, but is there a healthy amount of alcohol that you can still drink when you're trying to get pregnant?
Yeah. It's always a loaded question. I remember, going through those times where I was like, okay, well, I'll just cut out alcohol and then, I'll be, the best version of myself. But clearly you always feel deprived when you go in social settings. And then it's even harder to be in that infertility space because you feel like then you're being punished for it, So I try to educate women, look, bottom line, alcohol is a toxin. There's no other way of saying it. It's a fact, okay? Mm-hmm. It's a carcinogen. It increases your risk of cancer. But it's what we do to socialize in the United States, unfortunately. So, and I love that restaurants are having mocktail menus now. And
even weed, there's weed drinks now at restaurants in LA, which is awesome.
Go.
Yeah,
that's
THC
great.
drinks. And
yeah. And so I tell them, look, if you're gonna do alcohol while you're try to reserve it for the days that you're on your cycle, but clearly you have a window of time after you ovulate and before you either have a period or have a missed period where you have an embryo there, so you don't know
you're
if
working
you're
so
pregnant or
hard.
not.
It's like, why?
So wait those 2 weeks. Don't have alcohol those 2 weeks, but then after that, So
that's cool. And then what are some resources for women that are just starting to investigate? Obviously you guys, you can find her on Instagram, on TikTok, but what are some resources that you invite women to kind of go check out?
For fertility?
For fertility, and then also for perimenopause.
Yeah. For fertility, there's a reproductive endocrinologist called the Egg Whisperer. She's out of San Francisco. She's amazing. And she's one of the few who is holistic, but she still does IVF and all this stuff, but she's going to talk to you. And so her Instagram page, and she's got free stuff on her website about nutrition and supplements and all of that for fertility. But, I think that unfortunately going to your regular OBGYN may not be the best place for, having those conversations, those meaningful conversations about what you can do for fertility. But there's some great books. It Starts with the Egg is a really good book for just understanding how your lifestyle impacts your egg quality. And then, books on nutrition. There's a new book about nutrition for fertility.
Wow.
I think it's by Lily Nichols. So yeah, I would always say try to go the book route for those. I mean, there's so much mixed information on Instagram unless you have an accredited source, right? There's so many influencers that are like, well, this is what I did and this is how I get pregnant. I was like, well, I'm not you. So
it's hard.
Yeah.
But for everything, you're like, oh, this works.
Right.
People are mixing stuff, putting it up their vagina. It's like, don't listen to TikTok for everything.
Exactly.
Just for therapy. Sorry, we're kind of wrapping up, but I forgot to talk about this. This is something close to my heart. My girlfriend has endometriosis.
Yes.
Can you explain a little bit what endometriosis is?
Absolutely.
Yeah.
So, and that is something that I suffered with as well. I wasn't diagnosed until we went through infertility and I had the surgery. But endometriosis actually is a silent disease. It goes undiagnosed. Most women will see about 10 providers before they actually get diagnosed with endometriosis. Yeah. So a lot of suffering goes on before. But it's where the tissue that you would normally menstruate out, the blood and the tissue, gets actually expressed through the fallopian tubes and then implant on different areas in the body. Like it doesn't even have to be confined to the ovaries. We've had implants of endometriosis on the colon, the intestines, women's belly buttons. So I have a few patients that every month when they would have their cycle, they would bleed through their belly button. Yeah. Yeah.
Yeah. I've heard that like people can have it on their lungs and it really it makes you cough. And it's so painful.
Yeah.
She's bedridden literally. And I think the looming fear of her period has really worn her down.
Yeah.
What are some things that people, like some resources for endometriosis? Because most doctors are like, you can either get on the pill or have surgery. So you said just now you had a surgery for endometriosis or?
Yeah. So it was, it was a diagnostic. And then when they found it, they took care of it. I do encourage patients who, of course, in the functional space, we talk about that gut ovarian axis connection and how leakiness in the gut can really cause and stimulate inflammation that can impact endometriosis and the degree of endometriosis and how symptomatic you are from it. So we do a lot of gut health when it comes to endometriosis. We do a lot of toxin exposure. Studies have shown that women that are exposed to dioxins, BPA, cadmium have increased risk for endometriosis. And so we do a lot of detoxification. I actually have several women who came to me infertility from endometriosis. We did detoxifications and then they got pregnant naturally. And it's just such a beautiful thing.
That's our house right now. We're just throwing out all the people are like getting boxes of plastic from us. We're like, what is this? We're like, Merry Christmas.
Take it. Yeah.
So detoxifying meaning like cutting all the plastic out, cutting all the toxic like makeup products in your house.
Yes. Yes.
Okay.
And then we help them go through a specific detox protocol that really is optimizing their natural detox pathways, right? Sweating, peeing, pooping, all of those things. But endometriosis also is associated with a lot of deficiencies as well, as far as nutrients, zinc, vitamin D is one as well. So we do like a vitamin panel and make sure that they're doing all the things. There is some aspect of your immune system. So optimizing your immune system as well for endometriosis health. And then I still encourage, look, if after all of this, or even while we're doing this, go and see a endometriosis specialist surgeon. Like
I'm going to need that.
Not just any surgeon will do. Okay. There's I can't remember the name of the Facebook page, but there's a resource on Facebook. I'll look it up after this. But it lists approved endometriosis surgeons because not all OBGYNs could do endometriosis surgery, but there are now minimally invasive surgeons who have dedicated their lives to endometriosis excisional surgery. So you don't want someone to just go and burn it. You want it to actually be excised. So.
Right. Like it's like a cyst. Like you have to take the sac out.
Exactly.
It's so crazy because like so many people are, it's scary like to have a major surgery, but also it's like, it's debilitating.
Yes.
Yeah. And a lot of people don't even know that they have it.
Right.
Like, they're just like, if you're in horrible pain and you're bedridden from your period,
not okay.
There's something that's going on.
Yep. Yeah. I used to say like, oh, well, I mean, duh, of course I have horrible periods. Like you're shedding tissue, but no, the body has actually learned you shouldn't have pain, even though it's potentially a painful process. You shouldn't have pain. The body has adapted. It should not be associated with pain.
Right. Like cramps are normal because it's like shit. Like, do you ever get that little pokey in your butt? What is that? Like that little, like right when you're getting a cramp. What is that? Yeah. Is that just your colon? Like,
so with endometriosis, you tend to sometimes get a lot of endometriosis implants behind the uterus, which is you just have a little dead space between the colon and the uterus. Okay, but as something
it's like your colon taint. I get it. Okay.
But if something fills that space, then that's putting a lot of pressure on the nerves that are innervating the colon and the anal sphincter. So
yeah, she always gets like poking. Yeah. Like she just feels like little knives, like poking. Wow. So there's a lot. We've talked about a lot. We've expanded. Is there anything else that you want to share? Like just in general with women, like live, life, love kind of a thing that you encourage women to do?
Yeah, I encourage women to embrace their health. We do so much externally to make sure that we're preventing wrinkles or preventing hair loss or, preventing weight gain. But what are you doing to prevent the things going awry inside? Like really think about that. And for women that are thinking about fertility, like go sooner than later, talk to your doctor. That should be a priority at your annual visits, right? Cervical cancer does not kill many women in the United States anymore, thank God, because of pap smears. Wow. That's like 1 minute of the exam. You still have the other 14 minutes that you should be able to talk meaningful conversations about what's going on and what you can do to prevent infertility. Or you have perimenopause that might be coming on the cusp. I'm 39 years old. I'm not having symptoms yet, but what can I do? Mm-hmm. Like really start having meaningful conversations,
Yeah, it's funny how people don't. I get in there, I'm like, I write everything down before I go in there. And
awesome.
Just like, get to know yourself and then talk to your doctor. And if you don't know where to find a doctor, also find those resources. Talk to people, ask who their doctors are. Okay, so one of the things that was unexpected for me, I've always been like too thin, like give her a sandwich, like when I was little. And then when I started going through perimenopause, I noticed that it was a lot harder to lose the weight.
Yes.
And especially around my belly, like lower, I just like a fupa just arrived out of nowhere. And it was so hard to shed it. Like I was doing the same exercise.
Right.
So talk a little bit about weight gain during perimenopause and how women can prevent it and or fight it.
Yeah.
I don't know if they need to fight it, but
fight it.
You know what I'm talking about.
Yeah. So two things. So estrogen is stored in fat, okay? We have a lot of estrogen. Estrogen mimickers get stored in fat. And so in perimenopause, you will have such big highs with estrogen. That causes a lot of weight loss resistance. And then testosterone. So as testosterone levels drop, you get that central adiposity that happens right here. So things
Yours is
shift.
Such a much more. I'm like fupa, and you're like central adiposity.
So and then you get muscle mass reduction. You're doing the same exercises, but you don't look as toned as you used to. So that's testosterone. That's estrogen. Get your hormones checked.
So what's like some kind of exercises that you recommend? I've heard like strength training is really important.
For sure.
And cardio, like dancing is really important, just like releasing energy.
Yeah.
So are those kind of what you would recommend?
Strength training for sure. So strength training can actually help to naturally increase your testosterone levels. Ooh. Yeah. And that's like strength training, okay?
Yeah.
like that's cute, 5 pounds, fine, if that's
Right.
what you're going to do. But let's then work up, let's get those 20 pounds. Let's get those 37.5 pound
Oh my God.
weights out. Yeah.
I can't even lift one of those on my own. Yeah.
But yeah.
Strength training, dancing, and then leveling out your hormones is the way to lose your, what did you say? How did you call it?
Central adiposity.
Central adiposity. And is there a place where people can find you online? If you want to let them know.
So aliveandwell.health is my clinic website. And then I'm on Instagram, Dr. Roxanne Pero.
Awesome. Thank you so much for coming.
Thank you, Jade.
This is
great.
O Positive's The Stirrup. Make sure to follow O Positive. Check out our Instagram or TikTok. I'm at Jade Catapretta. And thank you for stirring it up.
Thanks, Jade.
Yeah.
I love being here.
Now we just go like this and they get a picture so they can green screen my face.